Let's see what lies they're trying to sell us today.
This week, I'm speaking with Dr. Rajiv Shah. He is president of the Rockefeller Foundation. He previously served in the Obama administration as the USAID administrator, and he worked very much on the U.S. response to the Ebola epidemic. Now that he's at the Rockefeller Foundation, he is part of an ambitious plan they have launched to ramp up COVID-19 testing nationwide over just a matter of weeks. The foundation has a history of working on outbreaks of disease in this country dating all the way back to the 1918 flu pandemic. Take a look at this.
You have to move from panic and posturing to a data-driven, evidence-based response. And that starts with access to testing and data around who has the virus and where are they. We're bringing together industry, science, and government to rapidly scale up access to testing so vulnerable families and essential workers can go back to work and be safe as they do so.
This all comes amid those alarming coronavirus numbers tonight. Cases surging in nearly every state, more than 82,000 new cases in just 24 hours, approaching a record set months ago. More than 1,000 deaths for 2 days straight now. Tonight, more than 223,000 lives have been lost. A public health official breaking down today. Hospitalizations increasing in 39 states. The Midwest and West hit especially hard. ABC's Alex Perez in Chicago tonight.
Tonight, an alarming surge in coronavirus cases, more than 82,000 in just the last day, the highest number since July. Deaths topping 1,000 for 2 straight days.
In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold. and the number of affected countries has tripled. There are now more than 118,000 cases in 114 countries, and 4,291 people have lost their lives. Thousands more are fighting for their lives in hospitals. In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.